prepare yourself. The first part of preparing the PACES is to prepare yourself with the clinical stations, the 4 clinical stations, which are the cardiology, the respiratory, the neurology, and the GI station. These stations, you need to have the clinical preparation for them in order to pass them with full marks or at least near full marks. Okay, so how to prepare them? You need to join a clinical course so that you will be introduced to these clinical stations. To start with, the preparation will go in three parts. The first part is to know the technique and to memorize the technique. Okay, so you will go to the clinical course. You will fix a way to examine a case of neurology, a case of cardio, or a case of a chest. Strict to this way of examination and repeat it as much as possible on your kids at home, on your friend, and in the hospital, so that it's fixed what are the steps of your examination. Okay, because it is a process like a driving, so you need to formulate this skill in order to get through and catch the clinical finding. The next step will be to memorize the clinical cases in each of these 4 big stations. So with a pen and paper, you need to have a notebook to write in a chest station. I may face COPD, I may face interstitial lung fibrosis, a scar, lobectomy scar, and what so on. In Egypt, the clinical courses in Egypt are already provided with these kind of cases that you need to prepare with. If you are not from Egypt, so you may be introduced to other clinical courses. There is also the PACES test videos. There is the internet, the YouTube videos. There is also some books like Cases for PACES and MRCB PACES Masterclass and the Oxford PACES. These are the books which prepare you with the most common cases which present in the real exam. Okay, so please prepare yourself with the clinical finding and study them by heart. You know, a case of COPD, I will find 1, 2, 3 in my examination steps. Okay. Number 3, you need to go for the discussion. The discussion need from you 2 questions: the differential diagnosis of your case, okay, and to formulate a plan. Okay, so you need to be prepared with these 2 questions. And in the previous books, which I will share in my group after this session, you can find the answers of this. And if you are attending a clinical course, also the clinical course will provide you with this. And please try to be simple as you can, because these are very simple and easy to miss if you formulate a sign. Try to stick and not to formulate any. After that, you need to be introduced to the marking sheet of these clinical stations. Okay, so this is a marking sheet of abdominal examination. Okay, from this marked sheet, you can find that there is marks on the clinical examination, which is the way you are examining. Try to be sleek and try to put a timer, even at home, to be strict to the time. Here, to identify the physical signs, which we discussed, that you need to memorize by heart what are the positive findings in each case of them. After that, this is the differential diagnosis, the clinical judge regarding the formulating an investigation and management plan, and the welfare is during your examination. Very easy, and also very easy to miss if you add physical sign here in the physical examination. Okay, so take your courses, try to start with this in your preparation to book a course and put yourself under stress of time, and then go home, study these cases by heart. So this is the first checklist. You need to put a checklist of the famous cases and how to pass through them. These are the mark sheet of the 4 clinical stations. Okay. After that, we will left with the two other stations, which are the long clinical consultation and the communication. Okay, for this you need also to be well prepared with an approach. Okay, so for those who are new to a PACES, who didn't enter the exam previously, when you go in this exam, you will have uh, two long clinical consultation. These are, I think, the most difficult of all stations. They are 15 minutes, okay, which you will they like need from you to have a specific history taking and targeted examination, and you will have 5-minute discussion with the examiner. Okay, from this long clinical consultation, if you pass this clinical consultation, I'm sure that 70 to 80% that you will pass your exam, because most who will fail the PACES exam will fail in these two stations. These are need specific preparation, which we will discuss. Okay, after that you will have two stations. Of one station, you will enter each of these long clinical consultation in a separate room. Okay, and there is a shift, it is a rotation. Okay, so you will start with a long clinical consultation, and then you will go for the next room, which there is the other room is a station of cardiology and neurology, both stations in one room. Okay, and after that they will change the room. The other room will have one station of respiratory and with communication, and the last room will be the other communication with the abdomen. So this is how the rotation will go in your real exam. Okay, the long clinical consultation will take you 20 minutes. Okay, the communication each will take 10 minutes, and each of the four clinical stations will also need take from you 10 minutes. Okay, so just put these four clinical stations in your pocket. Study by heart, be slick in your examination, practice makes perfect. Okay, okay. We are left with the long clinical consultation, which is the most difficult to prepare. How to go through long clinical consultation? Okay, so this is the mark sheet of the long clinical consultation. You will be marked on physical examination. You will mark it on identifying physical sign, and also the clinical communication skill, which is the history taking. Okay, and the differential diagnosis, the judge, which is the differential diagnosis and the management plan, and answering the concern, and maintaining the patient welfare during your examination. Okay, so to start with, preparing yourself for a consultation station, you need to go stepwise approach. How to start memorizing this? Okay, to start, you need first to go through systematic review. Okay, you can find this systematic review in some books like Roch, other book like Ryder. Okay, the Oxford PACES book, you will find this review. There is also MRCB PACES Masterclass. All of these books, you can find how to ask about systematic reviews. So this is your first point in your checklist, to memorize by heart how to ask about each system. Okay, the GI, the cardiovascular, and what so on. Okay, you can collect this, you can have this from the internet, join a course, whatsoever, but memorize this. This is your first step. Okay, after that, you need to have a scheme. Okay, a scheme, how to analyze a complaint. Okay, so if you have a complaint like cough, okay, so cough could be a symptom of different systems. Okay, so you need some analysis to analyze this complaint. This analysis is based mainly on the differential diagnosis, which is PACES wise. There is some differential diagnosis which they are insisting on discussing and bringing them very frequently in the PACES exams. So you need to have your differential diagnosis and to know how to ask about this differential diagnosis in very organized manner. Okay, so if we analyze, for example, a complaint like shortness of breath. Okay, so shortness of breath, you start by analyzing, is it your first time, onset, course, duration, attacks, diurnal variation, what increase, what decrease, and other associated symptoms. Then you go for the shortness of breath itself. You should analyze this. Shortness of breath at rest or on exertion. Is it on lying down? Is it like after walking for how many meters you develop the shortness of breath? How many pillows are you sleeping on? Is this shortness of breath awakening you from sleep, gasping for air? Okay, so this is the analysis of shortness of breath. Then you go for the rest of the analysis of the cardio chest system. Okay, so the shortness of breath, you need to exclude other cardio system, like the chest pain, like the awareness of the heartbeat. Okay, like other chest symptoms, like the cough, coughing up blood. Is this cough is dry or with phlegm? Okay, then number 4 is the alarming symptom. So this is how you should prepare. You should have a list of the main complaints, okay, in the internal medicine, which is presented also in these books, and you have to analyze them with a specific question, okay, so that you can, based on the differential diagnosis, you can ask thoroughly about this and analyze this complaint. After this step, so this is your second step. After this, you need to have a scheme of systematic review, starting from the complaint, then reviewing general system, then going to the woman associated questions, then going through the past history and what so on. Okay, so during our preparation in our course, okay, we have like this. This is a scheme of how we analyze a case or a complaint in a long clinical consultation, starting with analysis of the complaint, then asking the general 10 questions, then going through the past history, and if needed, review the differential diagnosis and systematic review. This is how you should prepare yourself. If you are taking like any courses, you're preparing with yourself just by studying whatsoever, but please try to stick to a scheme so that you are not lost. Okay, the difference here will be when going here. This is the most important, how to ask about specific question scheme so that you are not lost, and at the same time you ask thoroughly. Okay, so if it is a short, like the example we give, other examples like fever of pyrexia of unknown origin also will have its own specific 10 questions so that you ask. If it is a loose motion, also you will have some questions. So this is how in your notebook you need to review these questions. Also in your notebook, okay, when we are discussing with our candidate, we advise them or we give them a studying plan prepared with the complaints of each system. Try to be systematic, okay? Starting with the general scheme, you need to discuss something like fever, lumps or bumps, feeling fatigue, and whatsoever. Going to the neurology, you need to discuss like difficulty walking, weakness, falls, recurrent falls, dizzy spells, headaches, blurring of vision, double vision, like this. Going to the GI, the rheumatology, the endocrine, and what so on. So you will have like a curriculum which you need to go thoroughly and to analyze the complaints and under each chapter of this. This is how you put your checklist and you see your progress. Okay. After that, number 3 is to practice. Start to practice as early as possible. I advise all of you to start practicing الرخ. This is very simple book. You start practicing with your friend. Very, very simple. I think the exam is more advanced, but to start with, very good to you can like speak fluently and ask about he's writing the analysis of each system, and he's also have very good differential diagnosis. Okay. Once during the practice, you will start by memorizing this, but after a while you start to be more smart that when you catch a diagnosis, you go forward, you catch a diagnosis through this special scheme, okay? So you go forward by excluding the differential diagnosis and the underlying maybe other associated other associated causes and the complication and association. And you, with practice and studying, you will have also the famous PACES differential diagnosis available with you. So through practice, you will develop this skill because this is a skill. After that, when you have this study plan, okay, so the main you need to review very quickly, maybe through ChatGPT, maybe through any like very simple source, review the rheumatology system, the endocrine system, and what so on. Through this way of history taking, okay, you can prepare yourself with your friend in preparing the long clinical consultation, okay, guided by the marking sheet. Okay, are you following? Any question up to this point?
So far, it is clear.
Okay, excellent. Okay.
Dr. Duha, I just had a question. So
Yes.
you will give us the marking sheet so we
Yes.
know what we are supposed to do.
Excellent. Yes, yes. During the preparation, you need to be minded by your marking sheet, Dr. Iman. Okay. So this is just a moment. Okay. 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 Then, so this was the history taking part of the preparation of the long clinical consultation. The second part in the preparation of long clinical consultation is to formulate a targeted examination. Formulate a targeted examination in the real exam. In the real exam, we should be prepared to take this history taking in 7 minutes. Okay, so that after 7 minutes, I alarm you, go for targeted examination, because even if you take perfect history, you may not catch the case. Dr. Dina will tell us about her experience, but in her case, in the exam, which was bronchiectasis, the only clue was in the targeted examination. Okay, so not to waste your time, not take perfect history, just 7 minutes and go forward for the targeted examination. You need also to know how to formulate a targeted examination, because in my experience of previous candidates, in the clinical courses, they go stand in the front of the case, a case of cough, for example, they stare to the case, they don't know how to examine. They may examine, go for the chest, and they are standing lost what to do else. Okay, so we should learn from this point that to formulate a targeted examination for the long clinical consultation cases, go in 3 steps. The first step is to examine generally. The vitals are provided from outside. So in your paper, I will tell you now in few seconds that you will need to be prepared from outside with a paper for the long clinical consultation and for the communication. In this paper, you should write what is abnormal vitals written in this paper. So if he wrote you that the blood pressure 200 over 150, so this patient is hypertensive. Right from outside, the blood pressure 90 over 60, hypotensive. Okay. Then something you ask related to the vitals, like the bedside. You tell the examiner, I would like to measure the blood pressure sitting and standing. He will say, okay, there is no postural drop. You will not measure, but he will answer you, no postural drop, or there is a postural drop. I would order also a urine dipstick. Okay, and continue your general examination by the hand. Okay, just a very, very general screening of the hand. If there is any deformity, any nail changes, anything related to the skin. The pulse, fix it to all cases. Go for eye, for pallor and jaundice. Then for the tongue, if there is any cyanosis, then go for the GVB and the edema. So whatever your complaint, start with this general. This starting with the general examination, you are giving your brain some time so that you can think, okay, what else I need to examine in this patient, because this may be a case of shortness of breath in a scleroderma case. Okay, So by starting from this, I will then give my brain some time. I will be prepared so that I will go for the chest, I will go for the cardio, I will not miss palpating for the B2, for the pulmonary hypertension, and at the end, I will complete my examination by reviewing the scleroderma. Otherwise, you will, if you are going in rush in this long clinical consultation, a case of scleroderma, okay, go for examination for scleroderma. You will start by examining scleroderma, which is the skeletal deformity, the skin, and whatsoever. The patient is in pain, okay, or she is not cooperative. She will start to saying, doctor, please, the patient is in pain. And if the examiner like alarm you such in twice or at least once, okay, you may lose your welfare mark. And the case was what? Was shortness of breath. So it is have no relation with examining and wasting your time, examining the hand of the patient and putting her in pain, endangering your marks in the welfare. Okay, so the reasonable like approach in this case is to start with the general examination, and after that going for the complaint. Okay, start by examining the targeted system, and not all the targeted system. Okay, start to take some okay, so this is a shortness of breath. Okay, so your targeted system will be cardio chest. Okay, will I take full chest? No, you may not need full chest. You may need maybe to take the chest expansion and to auscultate and to palpate the B2. Okay, this is the most important. Going for cardiology, starting with auscultation. No need to palpate the apex and whatsoever, because you are searching for multi-system cause of this shortness of breath. Okay, and after that, you link this complaint with the association and complication to explore other positive finding in your case, because in your marking sheet, in the identifying the physical sign, if the case is scleroderma and there is some signs of scleroderma, like telangiectasia, like some deformity, skin changes whatsoever, he will put marks on this. Okay, but start always with your complaint. Okay, so please be minded in the long clinical consultation. The complaint from outside will be something very, 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 very general and very, very repeated. I think in the previous course, we did not exceed, I think, more than, 30 to 40 complaints. But these complaints may be presented in different differential diagnosis and in different scenarios. So you are linking what's from outside to the case inside your, So you are thinking of shortness of breath in a scleroderma. Think what could be the cause. Maybe it is a pulmonary embolism associated with thrombophilia. So this is how we go through, and this is how you need to train your brain to think of long clinical consultation. Okay, after that, so this is the history. This is how to formulate a targeted examination. By the way, during your clinical courses, you will be exposed to examining the multi-system cases. I call them the cases with multi-system examination, like the endocrinology cases, like the rheumatology cases, the hematology cases, like this. These have specific examination, okay? Like from different systems, you need to prepare on them. From this mix, we will finally have a formulated targeted examination based on the previous, we have the feedbacks of the previous exams. So we will train you to go through this feedback by checklist. You missed this and you missed that. But going through this, you will not, inshallah, miss anything. After that, answering the concern. Answering a concern, also many lose their marks in the PACES on this because of this concern. This concern need to be answered in when the examiner tell you 2 minutes remaining. You should go for the concern answer. How to answer this concern? By exploring the diagnosis, explaining the diagnosis to the candidate, to the surrogate, and after that exploring other differential diagnosis. What is your management plan for now, and any advices? This is how you go through this. So you need to tell the surrogate, after talking to you and examining you, you most probably have maybe pulmonary embolism, and tell it with the medical term. Don't be bothered by the medical term, but it is a condition in which 1, 2, 3, and try to explain that his defense system is doing 1, 2, 3, and to explain. But But in PACES, in long clinical consultation, he is giving the mark of the differential diagnosis so that you included the true solution of the case as number one differential diagnosis, and to have at least 4 differential diagnoses. So most of the time you will not have a long clinical consultation with only 1 diagnosis. No, because you didn't investigate yet. Okay, so but to confirm this, we need to do some investigation to exclude differential diagnosis, or I'm thinking about other diagnosis like 1, 2, 3. Okay, so for now, shall we admit this patient? If this patient is critically ill, so we need to admit him, involve a multidisciplinary team, start him on further investigation. You tell the patient we need to do some scanning or whatsoever. If the patient is need for maybe oxygen or something, so I will start him on some treatment or maybe blood thinner or something. Meanwhile, this gives the non-pharmacological. I need from you to stop smoking, moderate alcohol, stop driving, stop some drug. Maybe it is a case of Raynaud and the patient is taking beta blocker. So I need from you to stop this antihypertensive medication, or review the heart doctor to review your medication. Okay, give him the non-medical advices like wear gloves, avoid cold exposure, and give him a painkiller if needed. This is how perfectly answering the concern. In the real exam, don't please don't exceed your time so that you are missing totally the concern. This is the most stupid mistake candidates can do, to stick asking and wasting their time so that they do not have time to examine and to answer the concern. Even you did not take a perfect history, go time. Okay, if the examiner, if you didn't answer this concern fully, the examiner during the discussion, don't worry, just answer him with a diagnosis and differential diagnosis, and during the other discussion, the examiner during the judge, he will ask you about the plan and complete this. So you will not miss this this part. Okay, so after that you go with the examiner for 5 examiner for 5-minute discussion. 5-minute discussion. He will ask you, present your case very briefly, give him only the positive finding. What's your diagnosis and differential diagnosis? Give him 4, and please do he will put mark if the true diagnosis is one of the diagnoses or in the top of your diagnosis. You will get the full mark. Okay, if he keep asking you what else, so you did not realize the diagnosis of the case, you realize the diagnosis only after his questions, he may give you borderline, because he will write that he did not mention this the diagnosis only after giving hints. Okay, so you need from you to be prepared and study in your notebook with the differential diagnosis before entering. Okay, what's your management plan, admitting or not? Starting with the emergency ABCD, investigation to confirm the diagnosis, and investigation to exclude the differential diagnosis. Okay, not go with the discussion, I will do basic investigation, CBC, create, not like this. No, go, I will you say apart from basic investigation for all patients, and not to elaborate them. I need to confirm the diagnosis with 1, 2, 3. Be specific till the diagnostic. 1 lab, 1 imaging, and something invasive, and try to be something diagnostic. This is how to think, even if it is your first time to face a case. Lab, imaging, invasive. And I need to run further investigation to exclude the differential diagnosis. What's your treatment? Involve the multidisciplinary team. You are not treating alone. I need to involve other doctors. Tell him the non-pharmacological, like the patient education, counseling, physiotherapy, occupational, SALT team, bed, bowel, and bladder care, and the pharmacological, the specific for the case. Most of the time you will not have time, so the examiner will tell you, doctor, what else other than the non-pharmacological. Okay? Are you following up to this point? Okay, hello?
Yes, doctor.
Yes, okay, excellent. Okay, so during this long clinical consultation, how are you gonna, how they give you the marking? Okay, he will mark you on this skills, the physical examination skill. This is from the what we discussed, how to prepare yourself with the specific examination. Identifying physical signs, this with exposure. And please, please, if you are not sure of any physical sign in the exam, better not to say anything you are not sure about, rather than putting you adding sign. This adding sign will move your mark from borderline to unsatisfactory. Better not to tell. Only tell what you are sure about. The clinical communication, this is from the history taking, what you will need to be prepared. The differential diagnosis is very important. And here he's writing here, please, he is having sensible differential diagnosis, including the correct diagnosis. If you are not including the correct diagnosis, or if you included this after multiple questions from the examiner, what else? He may move your mark from satisfactory to borderline. Okay, the clinical judge, this is regarding the management plan of the patient, the investigation and the treatment. Answering the concern, very, very important. Many lost their mark because he didn't ask the concern, or the surrogate have multiple concerns and he didn't address them. And the welfare. The key to welfare, most candidates will not lose marks in the welfare, except for this stupid mistake I told you that some candidate do it. He lost the welfare in such easy case of shortness of breath in scleroderma because he wasted his time examining the skeletal system, and so that the examiner get angry from him. The patient was very annoyed, so she didn't let him examine her chest and heart fully. So only by preparing himself better, he may catch this mark. Okay. Okay, so going back to to what happened from outside. From outside in the long clinical consultation, so it is a long station of 20 minutes. Okay, outside you will have 5 minutes between each station. From outside, you be given something like this. This is some sample. يعني from outside, he is writing the patient details. Please make sure please to write your patient name, not to ask him inside, and your rule. Maybe right if it is like chest clinic or whatsoever. Then here will be the clinical problem. He is writing here a complaint of weakness and shortness of breath or whatsoever, so that you need to link this from something from outside. Okay. And this is the vital chart. The vital chart, I need from you to review this vital chart. And if there is anything in the vital chart abnormal, write it in your paper, okay? And if you are talking to the patient itself or his or her brother. So from outside, okay, this is the paper, the blank paper he is giving you from outside to prepare yourself, okay? This is your paper. So you divide this paper like this in half, okay? And also for those who are preparing and will prepare and will practice with their friends, you start with a blank paper, okay? In this blank paper, you in this side, okay, you will write these points: your rule, the name and age of the patient, and if you are talking to the patient or the next of kin, the complaint, the abnormal vitals, and then write the scheme. You remember the scheme I discussed about you, that starting by onset course duration and how to analyze the complaint and going through the systematic review, and after that the past medical history. This scheme, fix it for all patients. And please, many candidates tell, no, I don't need to write a scheme. I already memorized the scheme. In the real exam, you will be very, very anxious. Okay, so you and this scheme, although you are very well prepared many times, 100 times, in the real exam, because of stress, you may lost some questions, and this will be very important. So please write your scheme, starting with the 3 parts of this scheme. First part is analyzing the complaint. So if this complaint is shortness of breath, write the analysis of shortness of breath that you are prepared with. After that, the general, write the general. After that, the past history and whatsoever, write. The targeted examination, examining the complaint. So you are from outside prepared that I will go inside, starting with the general examination. After that, I will examine cardio chest. And after that, I will examine according to the system, because outside you don't know yet what will be the case inside. Okay, but you are at least prepared, okay, with the scheme. Here, I would like to write some differential diagnosis. Please be prepared with few differential diagnosis, okay? He may give you some easy case of hypoglycemia, okay? So hypoglycemia in a diabetic patient, he is writing from outside. So you may write some differential diagnosis, but please Don't be preoccupied with these differential diagnosis inside the station, so that you will not go through the scheme. No, because most of the in MRCB they learn teaching you to think, not to memorize. Okay, so okay, I will be prepared with the differential diagnosis, but please don't just go inside to ask about them. Go through the scheme and take the positive finding from from the surrogate one by one, going through the scheme, completing the examination, and at that point only, and only at that point, you start to formulate the differential diagnosis. Could be something from this, could be outside. Be very open-minded that you may face something new. Very easy, but you will do it. With practice, you will do it. Okay, the examination and answering the concern. Okay, so please, at your paper, if you are prepared with some differential diagnosis, you can write. If you are not prepared, no problem. Okay, if it is something very vague, no problem if you did not write. And this, keep it blank. Okay, so every time the surrogate is giving you positive finding, write. In the real exam, the surrogate will not give you more than 3 to 4 positive finding in the history taking. And if you ask about anything else, you will say, I don't know, I'm not sure, I'm free, no. Okay, so will be only few positive finding. So in this positive finding, okay, try to link the positive finding the surrogate give you to the complaint from outside. For example, if the complaint is weakness, okay, and from inside he tell you that the case is lupus, or the past history, the candidate is lupus. So think, what will cause weakness in lupus? What is the link? If you think in that manner, the link is autoimmune. What can link a lupus with weakness? Autoimmune. So I'm targeted in examination. I will exclude myasthenia. I will exclude other myopathies. I will exclude maybe hypothyroidism causing hypokalemia and causing weakness, like this. And with studying and knowing more, exposing to more ideas, so you will catch the link between the outside and the inside. During going through the scheme, sometimes some candidates, I advise them like this. If the complaint is very vague, something like fatigue or fever, you go through the scheme, exploring all the general questions, and then going to the past. But some other candidates may start with exploring the past history and then going to screening the general review. This is according to each candidate and how he is or she is preferring to ask. Okay, at the end of the day, ask both. If you are very fast in asking the general, so just to go asking them fast, and go for the past history and the drug history and the family history and whatsoever. Okay. Second tip in this point, when you're asking your surrogate, some of our excellent candidates who are very, very well prepared, they start to ask many questions at one time, at one breath. So with this, the candidate will only answer about the last question. He may ask the surrogate, do you a case of tummy pain? Okay, so are you having hard motion, loose motion, or passing out blood? She will say no. She means no to the last question. So please ask your questions one by one, because sometimes if you are asking too fast, the surrogate will not catch your question. And this happened in the last diet in Egypt. One of the candidates asked it, and asked about passing black tarry stool or passing blood, and the surrogate told her no. She didn't listen. The surrogate was not listening carefully, or the candidate were asking too fast. So if it is something crucial, ask step by step. Another thing is that other than linking the positive finding in the surrogate with the finding from outside, try to link them chronologically, because most of the time she may give you maybe a case of loose motion. Okay, this loose motion, she will give you in the traveling history that she with her husband traveled maybe to India, and she traveled to India 1 year ago. Okay, and the loose motion are when? The loose motion are 2 months ago. Okay, so he is giving this history of traveling to India, so that as a misleading answer. so that you will put in your differential diagnosis a travel diarrhea, although this have been long time. Okay, so please, when in the history give you positive finding, try to order them chronologically, so that you are not misleaded by a positive finding, because sometimes he put some misleading information here. And put in your mind that the cases in the long clinical consultation are not typical. Please, please be open-minded. Nothing typical in medicine. Even those who are practicing real medicine, we are not. We are seeing many atypical patients. So if one or two positive finding, it is most likely this diagnosis. Okay, don't be hesitant. It is this hesitant. Don't let like one question atypical, or one question the surrogate asked I don't know, to let you put down this differential diagnosis. Okay, it's better to discuss with the examiner with the possibilities, rather than omitting a possibility, and this could be the diagnosis of your case, and because the surrogate told you it is not, I don't know, or I'm not sure, so you omitted this possibility at the end. Okay, so this is how you prepare from outside for this long clinical consultation. Okay, to recap, a long clinical consultation to be studied, okay, need to first memorize how to ask about systems, okay? After that, memorize about how to ask about each complaint. Put a studying plan of the systems, okay? So I will study rheumatology, hematology, general, related to cardiology, related to neurology, like this. Under each of these chapters, you will have some complaints you need to be fulfilled, okay? You can, if you are like attending free courses or free sessions, or having YouTube videos or whatsoever, you will have this. You will write each time you catch a complaint, put it in this list, okay? Or if you're having like taking an organized course, also will be provide you with this, but it is all about your mindset of preparation. Then after that, after this scheme and whatsoever, prepare yourself with the discussion by reviewing from ChatGPT. ChatGPT is very easy. Just review how to investigate and treat the most common topics in the PACES. Rheumatology topics, scleroderma, rheumatoid arthritis, mixed connective tissue disease, endocrine and metabolic syndrome, and like this. Okay? And practice. Please practice as early as possible. Practice with your friends. Okay? Okay, so the last station will be the communication station. Very, very easy. The communication is very easy. Need just to be well prepared. The communication is in 10 minutes. Also the communication need to be prepared with a scheme. Okay, this is also a scheme of communication. Communication go in 3 parts. Okay, the first part is to practice. This have a scheme. From outside, this is written from outside of your rule, the name and age of the patient. Are you talking to the next of kin? The problem from outside, the task needed from you. Check the 2C. Is this diagnosis confirmed or it is uncertain? Is the patient conscious and competent? And the intro by identifying the identity of the surrogate, setting a report, setting the agenda, exploring his knowledge, and explain. We will discuss together how to like have fixed into intro. And to like practice it so that it will not take time. Then the body of the communication, what's the problem from the problem here and the task. Maybe in the communication you will have many tasks, so read the scenario very well and have the body depending on this problem and the task. Right, if there is in your case, if they wrote any details like percentage, like number, because he will ask you inside, and if you did not answer with this percentage and number, he will like cut your marks down. Okay, so most of the time in the communication, one station will be mistake. They love mistake scenarios. So you need to know how to, what is the judge, the clinical and the legal judge in the mistake scenarios, okay? And the other one will be a breaking bad news, explaining a procedure, something like this, something like palliative. They love palliative cases. Most of the time, this is what happened. So you need to be prepared in communication, how to, with the legal and the medical knowledge, and how to talk. The way of talking and the English words to prepare yourself with. After exploring the body and the communication, you ask the concern twice. Ask first concern, and then explore the social, okay, and then ask the second concern, and then finally summarize. Okay, to prepare the communication, also starting with the ROH, you have to review. There is a rider, there is a ROH, there is you can many YouTube videos, or you can attend our course. Hopefully, we will discuss this together. Prepare yourself with the knowledge and the scheme and the knowledge, which will put your mark in the judge. Okay, this is how very easy and very repeated. Okay, are you following up to this? Any questions? Hello?
We are following you, Doctor.
Yes, any question up to this point?
I think it is all clear for me.
Okay, great. So just generally, we advise like candidates to take at least 3 to 6 months to prepare for this exam by putting a checklist with the points they need to practice. Okay, you have a checklist of the clinical practice, checklist for the long clinical consultation and the communication, and have a friend or a study partner to start from day one to the exam date. There is some characteristic personal finding in the candidate who will pass. Okay, this is very important, and I realized this recently. Okay, they need some specification in the candidate. From the outside look, the examiner will tell this candidate will pass this exam. Okay, they need from him to be humble and safe. Okay, they are like testing you as a level of registrar. Okay, you are not a consultant, you do not know everything. Okay, you need to discuss for other consultation with other system, you need to involve the multidisciplinary team, so they need to from you to be safe. If he asked something that you don't know, please say I don't know, no problem at all. Okay, or I will go for my consultant. Okay, or very easy. Okay, not to add, because adding physical sign is somehow being non-safe doctor. Okay, you are adding sign, better to say I'm not sure or not to mention at all. Okay, after that they need from you a good clinical judge. This is very easy by reviewing they need from you something acceptable, nothing nothing magic. Don't like spend your time and spend your hours studying the topics of part 2. No, something very specific and very reasonable. No time in the exam for discussing your knowledge. Okay, they need from you to be confident, not hesitant. Please not to tell the examiner I'm not sure, I see about this, I can see a tinge of jaundice. No, not like this. Jaundice, clear. No jaundice. A slight weakness is no weakness. If they present you with something in the exam, only tell the خلاص the confident answer, not to be hesitant and not to withdraw your answers, because once you please be careful, once you spill any word from your mouth in the real exam, the examiner will write it in your mark sheet. So never tell anything unless, please take few moments before answering. Be like quiet, listen, take few moments to think and then answer, please. Better than just answering, so that you are not missing the time and talking too much. Don't talk too much, just few words, very concise, so that you are not look hesitant. Okay, the time management. Many excellent candidates fail this exam because of time management. They tend to be excellent, but very type A personality. No. You don't need to be something excellent, something magic. No, just time concise. Okay, and don't complicate things. Think easy, boss easy. Okay, most of the cases are repeated in the real exam. Okay, I think at this point, as a preparatory studying plan for the PACES, it's all clear. We will start at the 1st of November by starting in details explaining the long clinical consultation and the communication. Okay, any question up to this point? How many of you are joining the taking the exam the next nights?
Me, inshallah.
Inshallah. Okay, who else? Any questions? Okay. So, someone wants to ask something.
Yes, doctor, I want to ask.
Yes.
When you say that a candidate mentioned that he tried to find the finding, the skeletal finding in cases of scleroderma,
Yes.
and he wastes time instead of examining the chest.
Yes.
But actually, when the examiner question is mention your positive finding in the case,
Yes.
I guess he had to mention the finding which is found in the hand to
Yes.
confirm that the case is a case of
For
scleroderma.
sure.